The ਹਰਪ੍ਰੀਤ ਸਿੰਘ ਸ਼ੋਅ ਦੇ ਅੱਜ ਦੇ ਇਸ ਐਪੀਸੋਡ ਵਿੱਚ ਆਪ ਸਭ ਦਾ ਕਰਦਾ ਹਾਂ ਹਾਰਦਿਕ ਸਵਾਗਤ। ਅੱਜ ਦੇ ਇਸ ਹੈਲਥ ਸੈਗਮੈਂਟ ਵਿੱਚ ਅਸੀਂ ਤੁਹਾਡੀ ਮੁਲਾਕਾਤ ਕਰਾਵਾਂਗੇ ਮਿਸਟਰ ਐਲਨ ਗਲਾਸਰ ਨਾਲ, ਜਿਹੜੇ ਕਿ ਇੱਕ ਫਾਰਮਾਸਿਸਟ ਹਨ। ਆਰਥਰਾਈਟਿਸ ਇੱਕ ਬੜੀ ਵੱਡੀ ਪ੍ਰੋਬਲਮ ਹੈਗੀ ਹੈ। ਆਰਥਰਾਈਟਿਸ ਨੂੰ ਕੰਟਰੋਲ ਕਰਨ ਵਾਸਤੇ ਕਿਹੜੇ ਆਪਸ਼ਨਸ ਅਵੇਲੇਬਲ ਨੇ, ਉਸ ਸੰਬੰਧ ਵਿੱਚ ਜਾਣਕਾਰੀ ਲੈਣੇ ਆ ਐਲਨ ਗਲਾਸਰ ਤੋਂ। Welcome to the program.
Thank you, Harpreet.
Thank you. So today, if you could let us know the reasons why someone has arthritis. Is it related with age, and what options are available to control that pain? Because people who suffer from arthritis, they really suffer a lot.
Okay, there's really two main reasons for arthritis. One of them is as we age,
Right.
and we use our joints, and if you've lived a hard life and working hard, you can have bone-on-bone rubbing. Normally there's a cartilage, right? There's a cushion
Right.
in our knee. You've heard of cartilage and damage,
yeah.
right? But there's a natural cushion in our knee, for example, so that when you don't rub bone-on-bone. But as we age, and because of the nutritional problems, if you're not eating all the right foods that help your body repair itself, you can lose that cushion.
Right.
Then you're rubbing bone-on-bone. That's very painful. That's called osteoarthritis.
Okay.
And the numbers are 75% of the population who reach the age of 75 experience this bone-on-bone rubbing.
Okay.
Okay, problem number one. Now, problem number two is rheumatoid arthritis. This is an arthritic condition where you see a large amount of swollen joints. That can be very painful.
Right.
It can travel all over your body, and one day you might feel an ankle, another day you feel your arm, another day you feel your wrist hurts.
Right.
And it travels all over the body. This is when the body's immune system starts attacking the body.
Okay.
And every time that attack happens, you get swelling, pain, and redness, and you can even feel warmth in that joint.
Okay.
That can happen at any age. Happens from juveniles, from children, all the way to adults of any age.
Right.
They're treated slightly differently. So
what are the prescriptive as well as the non-prescription drugs available for this?
that's right. So for prescription drugs, we always start with things called anti-inflammatory drugs.
Okay.
Especially with rheumatoid arthritis, we want to reduce the swelling, because where there is swelling, there's always damaged tissue, there's swelling, and the body then sends the message, don't move that joint, it's swollen.
Okay.
Right? We can't immobilize it. That's why you get the pain message.
Right.
Hopefully then the body's trying to heal it. So our drugs are focused mainly on interrupting the body's inflammation
Right.
process.
Right.
So you've heard drugs called naproxen, drugs called Celebrex. Those are the two major drugs that are used.
Okay.
Okay, those are anti-inflammatory drugs.
So that's just a temporary relief.
Exactly. It's temporary relief. The big problem with a drug called naproxen, and I mentioned this, over a year, for every 100 people who take it, one
Right.
person is going to get a bad stomach bleed.
Okay.
So that means admission to hospital.
Right.
There's always risk to these. That's why most of the time the doctors will tell you, take Tylenol.
Right.
Okay. Now we've discussed Tylenol. It's a very effective pain reliever, but it does nothing for swelling.
Okay.
The unique thing about the naproxen, the Celebrex of the world, it controls pain and it controls swelling.
Right.
Whereas a Tylenol, whether it controls pain only, does nothing to help your swelling.
Okay.
That's the prescriptions. If you're in really severe pain, you will go to a narcotic.
Right.
Now, narcotics are just a class of drugs that are tightly controlled. I didn't bring any today, but people have heard of Tylenol with codeine.
Right.
The problem with codeine, especially in people as we age, we're 60, 70, 80 years old, it causes severe constipation.
Okay.
Then you're taking another drug to get
meet
rid
that.
of the constipation. You have to take a laxative to get rid of
Right.
the constipation. That's not very pleasant. So it is effective. Yes, we can control your pain.
Right.
If you have uncontrolled pain, there is no excuse for it. I want to tell you that I know if you'd come into Mark's Pharmacy, 80th and Scott Road, I personally can help you and make sure that we get you out of pain, even if it means using narcotics.
Right.
Because they are effective. Because there's some work better for women, some actually work better for men.
Right.
And there's something, if you have been in long-term chronic pain,
Right.
this is interesting,
Okay.
and which unfortunately many of your viewers are in long-term chronic pain from arthritic conditions or sore
Right.
joints, you can take a product called DM. This is what's in cough syrup.
Okay.
Because there happens to be two pathways to pain. One is when you bash your hand and you can feel it.
Right.
Immediately, that's called acute pain.
Okay.
The other is diffuse long-term pain, which happens in swollen joints or arthritic joints, where there's constant pain there.
Right.
There's a second pathway to pain. We can shut that other pathway down using that simple cough syrup, DM. You just take it like it says on the bottle.
Right.
So you can also, there's a clue to help yourself if you're in this chronic pain.
Okay.
Try some DM. Take just on whatever it says on the label on the bottle. That's how
Right.
much you take to help you control your pain.
Okay. And what about the non-prescription drugs?
So, because we talked about the adverse effects of prescription drugs,
Right.
which is constipation, doping, drowsiness, or narcotics, and of course long-term issues with your stomach,
Right.
and with the anti-inflammatories. There's another set called biologicals, which are extremely expensive. We're talking thousands of dollars a month.
Okay.
But that also may help you. The flip side is, because they're suppressing your immune system,
Right.
your risk for cancer and this other kind
Oh,
of
that
problem
goes up.
Goes up.
Okay.
So it's a risk benefit.
Right.
That's why I always look for natural products, which you can find at Mark's Pharmacy, 80th
Right.
Scott Road. So number one thing, you may have heard homeopathic product called Trameal.
Okay.
Trameal comes in a rub, comes in a tablet you put under your tongue. One tablet 3 times a day is usually the dose for an acute pain. If you just got a brand new ache or pain,
Okay.
this is a great thing to
Okay.
apply. If it's a long-term ache and pain,
Right.
there's a product called Zeal. It's a homeopathic product called Zeal, which also comes in a tablet form and a drop form.
Okay.
You'd use that
Right.
together. So again, the advantage of this, absolutely no side effects, and there's really good science proving that these products do work and help.
Okay.
Another interesting product is this joint formula 14 called
Right.
Sierrasil. It is just basically a natural substance, minerals,
Okay.
and this combination of minerals absolutely does stop the inflammation. So if your problem is arthritis, rheumatoid arthritis, and there's a lot of swelling involved, this is a great choice.
Okay.
It will interrupt the swelling, stop the body from swelling up, therefore controlling your pain.
Wonderful. We'll go for a short break, come back, and you have other things also which can be utilized, and these are non-prescription drugs, which means they don't have any side effects. We'll talk about this after this break. ਸੋ ਸਵਾਗਤ ਕਰਦੇ ਹਾਂ ਜੀ ਇੱਕ ਵਾਰ ਫਿਰ ਆਪ ਸਭ ਦਾ ਅੱਜ ਦੇ ਇਸ ਹੈਲਥ ਸੈਗਮੈਂਟ ਵਿੱਚ। ਐਲਨ ਗਲੈਸਰ ਜਿਹੜੇ ਕਿ ਇੱਕ ਫਾਰਮਾਸਿਸਟ ਹਨ, ਸਾਨੂੰ ਦੱਸ ਰਹੇ ਨੇ ਕਿ ਆਰਥਰਾਈਟਿਸ ਦੇ ਕੀ ਕਾਰਨ ਹੁੰਦੇ ਨੇ, ਤੇ ਜਿਸ ਤਰ੍ਹਾਂ ਇਹਨਾਂ ਨੇ ਦੱਸਿਆ ਆਸਟੀਓਆਰਥਰਾਈਟਿਸ ਅਤੇ ਰਿਊਮੇਟਾਇਡ ਆਰਥਰਾਈਟਿਸ, ਉਸ ਦੇ ਬਾਰੇ ਇਹਨਾਂ ਨੇ ਦੱਸੀਆਂ ਜਿਹੜੀਆਂ ਦਵਾਈਆਂ ਤੁਸੀਂ ਲੈ ਸਕਦੇ ਹੋ, ਪਰ ਉਹਦੇ ਸਾਈਡ ਇਫੈਕਟਸ ਬਾਰੇ ਵੀ ਦੱਸਿਆ ਕਿ ਤੁਹਾਡੇ ਪੇਟ ਵਿੱਚ ਦਰਦ ਹੋ ਸਕਦੀ ਹੈ, ਬਲੀਡਿੰਗ ਵੀ ਹੋ ਸਕਦੀ ਹੈ, ਕੌਨਸਟੀਪੇਸ਼ਨ ਹੋ ਸਕਦੀ ਹੈ। ਇਸ ਕਰਕੇ ਇਹਨਾਂ ਨੇ ਕਿਹਾ ਕਿ ਨਾਨ ਪ੍ਰਿਸਕ੍ਰਿਪਸ਼ਨ ਡਰੱਗਸ ਜਿਹੜੇ ਨੇ ਉਹ ਵੀ ਅੱਜ ਅਵੇਲੇਬਲ ਨੇ ਮਾਰਕੀਟ ਵਿੱਚ, ਜਿਨ੍ਹਾਂ ਦਾ ਕੋਈ ਸਾਈਡ ਇਫੈਕਟ ਨਹੀਂ ਹੁੰਦਾ। ਤੇ ਜਿਸ ਤਰ੍ਹਾਂ ਹੋਮਿਓਪੈਥਿਕ ਦੀ ਇਹਨਾਂ ਨੇ ਗੱਲ ਕੀਤੀ, ਕੁਝ ਪ੍ਰੋਡਕਟਸ ਦੇ ਬਾਰੇ ਦੱਸਿਆ। ਉਸ ਤੋਂ ਇਲਾਵਾ ਮਾਰਕੀਟ ਵਿੱਚ ਹੋਰ ਵੀ ਚੀਜ਼ਾਂ ਉਪਲਬਧ ਨੇ ਜਿਨ੍ਹਾਂ ਨੂੰ ਤੁਸੀਂ ਲੈ ਕੇ ਉਹਨਾਂ ਦਾ ਸਾਈਡ ਇਫੈਕਟ ਤੋਂ ਬਚ ਕੇ ਤੁਸੀਂ ਆਪਣੀ ਬਿਮਾਰੀ ਦਾ ਇਲਾਜ ਕਰਵਾ ਸਕਦੇ ਹੋ। ਕੁਝ ਹੋਰ ਵੀ ਪ੍ਰੋਡਕਟਸ ਜਿਹੜੇ ਅੱਜ ਮਾਰਕੀਟ 'ਚ ਅਵੇਲੇਬਲ ਨੇ, ਆਓ ਉਸ ਬਾਰੇ ਜਾਣਕਾਰੀ ਲੈਂਦੇ ਹਾਂ। ਸੋ ਬਿਫੋਰ ਦ ਬ੍ਰੇਕ, ਲਾਈਕ ਯੂ ਵਰ ਟੈਲਿੰਗ ਅਬਾਊਟ ਦਿਸ Traumi and this homeopathic product, and you also talked about this joint formula.
Yes.
What other things are available?
Okay, so there's a Canadian product. It's really interesting. It's called Purifight. It's from the California poppy.
Okay.
It's a natural analgesic, so it's a natural painkiller. It also helps you sleep at the same time. So
Okay.
it's kind of a bonus. You'll get good pain control, and you'll be able to have a better sleep.
Okay.
The key with everyone is if you're in pain, especially from arthritis, you also get depression.
Okay.
Because chronic pain can lead to depression. So
Okay.
I certainly want to help my clients who come to Mark's Pharmacy, 80th and Scott Road, to help them avoid that consequence of
Right.
chronic pain. So I've looked for natural products that seem to help people. There's
Okay.
another natural product, California poppy. Here's an interesting product. It's vitamin D.
Okay.
Part of being in Canada is we don't actually get
Yeah,
enough
we
sunlight.
have less of vitamin D.
That's right. And
Yeah.
we know that vitamin D, especially in a liquid form, because we can get a lot of it
Right.
in one drop. This one's got 1,000 units in one drop. And the recommendation currently is you do 4,000 units a day at least.
Okay.
That number one helps control depression because it is called the sunshine vitamin. Number two helps control your body's immune system.
Okay.
So we're not destroying a joint. That's what's happening, of course, in arthritis. One, rheumatoid arthritis.
Right.
We're destroying ourselves. We can get better control. Helps our body immune system.
So you just put it on your skin and or
This
you
one you take orally.
take it orally.
Okay.
Right.
Yeah, I like the drop. You can leave it in your mouth. You get quick absorption.
Okay.
Because sometimes if it goes through the stomach, it has to pass through the liver, and the
Right.
liver gets rid of things. It's called detoxify
Right.
things. So if you just put the 3 or 4 drops under the tongue once a day, let it absorb there, you're doing a lot to help your body get the
Okay.
extra vitamin D we're
Right.
not getting because we don't have any sunshine here. Now, here's another interesting one. This is
A gel.
a gel. This is called Voltaren. At a higher dose on prescription, it's on prescription. At this low dose, it's safe for the public to use. Again, it's a topical joint pain.
Right.
Specifically, it's an anti-inflammatory.
Right.
So if you have swelling in an area, this is a great product to use.
Okay.
And it will also control the pain. So it does
Right.
both things. It's got pain control. It's got this prescription drug called diclofenac,
Right.
which when you take it orally can irritate your stomach, but when you put it right on the skin topically, won't do that. It will give you the pain control. It will give you the decreased swelling
Right.
in a particular area. And finally, one of the things that helps people with arthritis is hot or cold.
Right.
So we do have these simple things. These are non-drug means. They're gel packs. Where you got a small one for your
Right.
hand or wrist, and you got giant ones for your lower back.
Right.
And these are all available, and these can be hot or cold. Depends what helps most people.
Okay. So this non-prescription drugs, as you said, they don't have any side effects. That's wonderful. This is for those people who are having some issues with arthritis. But is there anything to prevent, like people should not have arthritis? Is exercise the best means, or there are some non-prescriptive drugs which can be taken to avoid arthritis?
That's a really good question. We don't know if you're going to get arthritis. So I will tell you right now, if you do have pain in the joint
Right.
and you stop using it, it will get worse.
Okay.
So basically, to stay flexible all your life, it's use it or lose it. Our body is use it or lose it.
Right.
That's unfortunately that simple. So if you don't exercise, if you're sitting at home all day,
Right.
and don't move your body, and you get a pain, it'll just get worse.
Right.
You need to keep moving. So
Right.
I absolutely think and agree that 30 minutes of even walking every day, moving your body, getting out and walk,
Right.
just raising your heart rate a little bit, is essential to make sure your joints stay flexible.
Wonderful. Thank you very much for all this information. Thank you.
Thank you.
ਸੋ ਐਲਨ ਨੇ ਜੋ ਸਾਨੂੰ ਗੱਲਬਾਤ ਕੀਤੀ ਹੈਗੀ ਕਿ ਨਾਨ ਪ੍ਰੈਸਕ੍ਰਿਪਟਿਵ ਡਰੱਗਸ ਵਿੱਚ ਇਹਨਾਂ ਨੇ ਦੱਸਿਆ ਜਿਸ ਤਰ੍ਹਾਂ ਕਿ ਜੈਲਸ ਵੀ ਹੈਗੇ ਨੇ, ਉਸ ਤੋਂ ਇਲਾਵਾ ਤੁਸੀਂ ਕੋਈ ਵੀ ਨਾਨ ਪ੍ਰੈਸਕ੍ਰਿਪਟਿਵ ਡਰੱਗ ਲੈ ਕੇ ਉਸ ਦੇ ਸਾਈਡ ਇਫੈਕਟਸ ਤੋਂ ਬਚ ਸਕਦੇ ਹੈਗੇ ਹੋ। ਫ੍ਰੀ ਕੰਸਲਟੇਸ਼ਨ ਲਈ ਤੁਸੀਂ ਮਾਰਕ ਫਾਰਮੇਸੀ ਤੇ ਜਾ ਕੇ ਐਲਨ ਨੂੰ ਮਿਲ ਸਕਦੇ ਹੋ ਤੇ ਉੱਥੇ ਆਪਣੇ ਇਹਨਾਂ ਕੋਲੋਂ ਇਨਫੋਰਮੇਸ਼ਨ ਹੋਰ ਲੈ ਸਕਦੇ ਹੋ।